Hi, I am Dr. Shazjeel, and today I would like to discuss a very important and common topic about the red reflex or fundal glow. Now you can see this patient, it is lying on the table. He has got mild posterior subcapsular cataract, but with this poor glow. Now, what is the cause of this poor glow? Because it is whitish, yellowish. So it tells you about the health of the retina, health of the back of the eye, and straight away you can tell your patient that the cause of the decreased vision may not be your posterior subcapsular cataract, but that thing which is causing poor glow. And the thing in this patient which is causing poor glow is dense asteroid hyalosis. You can tell the patient that you may not get very good vision. Well, our good luck was that this abnormal fundal glow was due to asteroid hyalosis. Usually, when asteroid hyalosis is mild or moderate, it does not cause any visual deterioration. But if very dense, like it in this case, it can affect the vision. So, fundal glow assessment is very important. Sometimes you get a patient with a mild posterior subcapsular cataract. Vision is counting finger even in the dark, and glow is just like this. I have seen many patients, and now you should be able to know that the posterior subcapsular cataract will not cause that much decrease of vision alone, but the fundus glow, if it is yellowish or whitish, it means it is abnormal and there is some pathology. The decrease of vision is due to fundal pathology, and when you check the fundus you get severe retinitis pigmentosa or geographic age related macular degeneration or diabetic uncontrolled maculopathy. Whenever I get such glow in a diabetic patient, I tell the patient that you have got poor glycemic control and kindly control your sugar. So why red reflex occurs? Well, red reflex occurs because the light that enters into our eye, it reflects off the back of the eye, which is fundus, through the media vitreous, lens and cornea, and normally it is reddish or orange or red. If it is absent, if the red glow is absent, it means there is some media opacity, there is corneal opacity, there is a dense hard cataract, there is a vitreous hemorrhage, or something is abnormal on the retina. Now this is the second patient which I am showing. You can see this patient is pseudophakic. When I checked this patient on the slit lamp, straight away I got abnormal fundal glow. The fundal glow was abnormal. There was a whitish thing at the back of the eye. When I dilated him and with indirect ophthalmoscopy, I saw he has got bullous rhegmatogenous retinal detachment. You can clearly see here the detached retina. So one of the differential of the poor fundal glow or whitish fundal glow is retinal detachment as well. You can get in children. Fundal glow is very important because in those in which there is abnormal red reflex, the patients may have congenital cataract, retinoblastoma, persistent fetal vasculature, Coats disease, toxocara, retinal detachment as well. In a very high refractive errors, amblyopia and strabismus, you can also get abnormal red reflex. Now here you can clearly see in my second patient the detached retina. So And one of the other differentials of yellow or white fundal reflex is if you get a very large chorioretinal coloboma. Few days back I have shared a case of a child in which there was leukocoria, white pupil, and that white pupil was because of a large chorioretinal coloboma. So colobomas can also cause decrease of vision, and they can also retinopathy of prematurity. These are the diseases that in which you can get abnormal yellow or white reflex. In most of the patients in a routine, when we get abnormal red reflex, we asked about diabetes and they are diabetics. At the end, few days back, one of my friend was operating upon an eye with a posterior subcapsular cataract, and then he referred the patient that see whether his back of the eye is normal or not. When I checked this, that patient had got vitreous hemorrhage. So vitreous hemorrhage can also cause abnormal fundal glow. So these are the few common differentials which can cause abnormal fundal glow, and you have to treat these pre-existing conditions before embarking upon the cataract surgery. Thank you very much.